Annually during the flu season, which is, as I just said, a fairly long season, we see between 7,000 and 61,000 deaths per year, and that's over the last decade. On average, we see 37,000 deaths per year during the entire flu season. This year alone, during the COVID-19 season, we have had 39,000 deaths reported by the Centers for Disease Control. So that's over 3 months. And we know on the very first day of COVID-19, there was not very much impact in the United States, just 1 or 2 people sick. So it has put a significant strain on our medical system, and that's why we took the measures we did to flatten the curve so that we would have that capacity, and so that each person that gets sick has the opportunity to go to the hospital and isn't turned away from those life-saving measures, including the ability to be on a ventilator. So it's the hard work that everyone here in Hamilton County and the state of Ohio and others in the country, it's our hard work that has helped flatten that curve and help keep people alive throughout the state. We've had lots of questions, particularly now that the governor has discussed with Director Acton about the opening on May 1st of some forms of business. I don't have a crystal ball, and certainly the governor and director are working very hard to understand what measures and steps need to take place to keep Ohioans safe. They have shared, and we know that with each new phase of business opening, we know more people will get sick. The more we are together, the more people have the ability to spread COVID-19. Director Acton accurately described the way we're bringing business back on as a dimmer switch. We're going to slowly start to bring in the businesses that we think can safely occur, and we're going to do so in a way that will keep people safe and ensure that we have hospital capacity for those that do become ill. We know that the state is looking to begin doing some elective surgeries, and there is a long process and plan in place that they are working through to make sure those are the surgeries that are most important, and also preserving protective equipment for those first responders. We know the state has looked at schools, and they have shared that they are not opening schools again this year, and they even shared that when we start to look in the fall, that opening schools may look different. These are all steps that they are taking to ready us to make sure that we're keeping folks safe as we do this work. As we open businesses back up, and while I don't have a crystal ball as to what businesses will be opening, I do know that my team, who is doing the contact tracing, will be busier than ever as we see little spikes in illness throughout the county at various businesses, nursing homes, or other locations. My team will begin to do that contact tracing and education to make sure that as many people that could have been impacted are isolated, and so that we don't see a significant spread of COVID-19 as we begin to do this great work of opening Ohio back up. Our goal is to quickly address any small hotspots to prevent those larger outbreaks from developing. In closing, I really just want to reiterate my thanks to all the healthcare workers and first responders that have been very critical as we work through COVID-19. They have really played a key role in keeping us safe, and when we can't safely recover from COVID-19, they have played a key role in making sure that we have the best chance of survival as possible. With that, I'll turn it over to Commissioner Dreihaus. Thanks.
Thank you, Commissioner. Thank you so much. And Greg, of course, will stick with us for questions. So the next thing that we're going to talk about is the budget, the county budget. As you know, there is federal legislation rolling through. We have been advocating very hard to try to be included in some of the relief package that is coming down for businesses, for hospitals, all super important. We understand the importance of those dollars. We were hopeful that we would get some relief also. We did not, from our understanding of the language. My caveat on that is I want to thank especially Senators Portman and Brown for working diligently to make sure that their colleagues understand the impact to local governments of this slowdown, especially those of us that rely on sales tax or earnings tax. The hits are tremendous, and my understanding is there will be another package that hopefully will provide some relief to the public sector. So, very, very grateful for their advocacy for both of our delegation, both in the House and in the Senate. I did say this yesterday, and I liken this to, the money that we've received is very restricted and can be used for our response to COVID-19, none of which could have been included in a previous budget. Okay, so that's what we've got. So there are new dollars, and it's helpful. And we've been able to rehouse people that are homeless in this community. We have been able to purchase PPE. We have been able to separate the 911 callers, as we've talked about before. However, we've got this huge hole in the budget, and public sector employees that have been furloughed. These are real jobs too. And also, as you think about this in context with opening up part of the economy, when you think through the partnership between the private sector and the public sector, the private sector does depend on our planning and development department to review their plans and okay the plans for any new construction that's going up. They do rely on us to do some permitting and some zoning work. They do rely on the Public Health Commission or the Public Health Department to make sure that restaurants are opening up in a safe way. And that if there are situations where things are not safe, public health goes in and responds. So you can see this partnership between the private sector and the public sector is important and always has been. And so it will be difficult to open up part of the private piece of the economy without having the public side alongside that recovery. And so I just want to emphasize this because I'm not sure everybody always connects the dots between what the work we do, because it is relative to courts and jails and the other really important things that we do, but there are also these other side of the house where we interact every day with the private sector. And one analogy I will use with you, and again, very grateful for the dollars that we've received from the federal government to respond to COVID-19. So I liken it to sitting in your house. You've got a mask on because you were able to purchase masks, but you weren't able to pay the utility bill or the rent or the mortgage, and so you're sitting in the dark with a mask on. So it's helpful, but we're hoping to have additional help for just the basic services that the county provides. So with that, I'm going to turn it over to Jeff Aludo. Jeff has been talking to all of the departments. Remember, there are departments under the county, and then there are departments led by other elected officials throughout the county. And so it can be a little challenging to get everyone to behave together in a coordinated fashion when it comes to some of these budget reductions that we've been talking about. Jeff Aluda, the county administrator, and the budget team have done that, and so every county department and every department under an elected official is participating in the effort to bring down our expenses, because we know we're going to have a hit when it comes to the revenue side. So with that, Jeff, I'm going to turn it over to you.
Thank you, Madam President. I appreciate it. Good morning to everybody. First of all, before I get started, I do just want to do two thank yous. Number one, thank you to all the county employees who continue to do everything that they're doing in providing service to the public during what are unprecedented times. They're doing more with less, and they're doing all of this as part of public service at the same time that they're dealing with the personal stresses that everybody else is dealing with at home. So I really want to thank them. I also want to echo President Dreihaus in thanking everybody who helped advocate for some of the legislative flexibility that we're looking for in the most recent stimulus package. Our federal delegation, and also those here closer to home, local elected officials, et cetera, who I know reached out to our local congressional delegation to try to push for some of that flexibility in our CARES grant, our CARES Act allocation. As Commissioner Dreihaus indicated, we didn't get the flexibility we were looking for this time, but we are still pushing, and we're going to keep advocating for it. And I'm cautiously optimistic that we are going to ultimately get some of that flexibility that we are looking for, although, as she indicated, we have not received it to date. So just in terms of picking up on what was talked about earlier on health, in terms of the numbers, as we've talked about before, but for folks who might not have seen previous iterations of this briefing, the county faces a budget gap of between $40 and $60 million in terms of a revenue shortfall this year. That's roughly 15 to 20% of the county's general fund budget from a revenue perspective. We're still waiting on data to refine those numbers. That's one of the frustrating things about this particular budgetary challenge is we know that the hit is coming. We just haven't seen it in full yet. We've started seeing it in some areas. We've started seeing casino revenues plummet. We started seeing some of our property transfer fees go down, but the big hit will come in sales tax. We just haven't seen that yet. We started to see a little bit, the state provided us some information telling us that some numbers in February, towards the tail end of February, started to fall by roughly 10%, but our collection of sales tax is delayed by 3 months. So the month when all this really started to hit in March, we won't know that until June. So we're making decisions on the fly right now without a full complement of data that we really want. Now, hopefully, we'll start to see some more news from the state later on this month as to what they saw in March, and that should give us a little bit more information on which to plan. But we did ask departments in the meantime, knowing that a hit is coming. We asked departments for budget reductions to help us close that anticipated shortfall. And this is a thing that is happening in local governments, cities, counties, villages, townships, all across the nation. Hamilton County is by no means alone in this. So over the past several weeks, departments and elected offices have come forward with approaches to how they're going to help reset their budgets to help with this shortfall. And at this point, the numbers we've produced between $20 and $30 million of savings in terms of how departments have come forward with their approaches. Those plans involve non-personnel reductions. They involve use of furloughs, salary reductions, reallocations of restricted funds, and those plans are going into effect now, and they will go into effect on a rolling basis as departments and elected offices are able to implement them. In particular, we know that there are north of 200 furloughs that are currently being implemented within the county, and more likely to come in the coming weeks as additional departments come forward with plans. We know that some of the departments, some departments are still working on plans. We've been talking with departments even as of this morning that they are still formulating plans to come forward to assist. Other departments have submitted plans, yet have told us that they're currently assessing other options for how they can continue to help more. But as I've said, the nature of this problem is really unique. We expect it to be temporary. So as such, and while we have talked about a number of 20% or 15 to 20% in terms of our revenue gap, our emphasis with departments have been on taking action that can be implemented quickly and that can be scalable. And I've told departments very directly, many departments have come and said, look, it's going to be very difficult to hit a specific target number without decimating the service that we have to provide to the public. So my response to those departments have been, do what you can do now, get it in place, and make sure it's scalable so that we can pull back on this or we can escalate it more if we need to. And I can say every department that I have spoken with, which I think at this point has been every department in the county, everybody understands this problem and everyone is doing what they can to be supportive. But let's be clear. At the end of the day, as Commissioner Dreihaus indicated, as this economy reopens, as this community reopens, the court system can't close. The jail can't completely stop accepting inmates. The 911 center can't stop accepting calls. The election system has to function. So we have to make sure that as we solve the budget crisis, that we do it in a way that is prudent and in a way that allows us to quickly scale up to meet the needs of the public as those needs restart with a restarting economy. So I can tell you that departments have gotten us a great start in terms of where we are with our budget situation. And as departments come forward with what they can do, I have also told those departments that we will do what we can do prudently whether it is through the allocation of federal grant funds, as Commissioner Dreihaus alluded to, whether it is the use of our general fund reserve. We will do what we can do to meet departments at a level so that we can solve this problem together, make sure that we meet the financial issue, but at the same time make sure that we are not devastating public service and that we are ready to respond as a county when the community ultimately reopens. So, Madam President, that concludes my comments. I'm happy to take questions as they... Sure. Commissioner Dreihaus asked me for a couple of examples of some of the things that departments are coming forward with. I'll start with just all the departments under the Board of County Commissioners. So the Board of County Commissioners, while we talk about it as one entity, includes multiple departments from the Budget Office, County Facilities, Planning and Development, 911, Human Resources, County Procurement, and a whole host of other non-personnel areas like different contracts and subsidies we do to different funds. So under the Board of County Commissioners, we have implemented 26 furloughs. We have also, we recognize that we may need to go further with those furloughs in a second round. So again, as I said earlier, we're looking to do things in a way that is scalable. We're going to be revisiting this on a weekly, every other week, and monthly basis to see what more we have to do. So we have started furloughs as of this point. We're prepared to do more of that as we need to. We have done salary reductions for key administrative staff and the Board of County Commissioners. We're cutting over $7 million in non-personnel expenditures. That includes things like critical county projects in county facilities, capital projects, and contracts such as site security contracts in various buildings. We're also reprogramming close to $3 million in restricted funds towards general fund operations where we can do that. And we're also eliminating close to $2 million in what were otherwise vacant positions. So that's a little bit about under the Board of County Commissioners. Municipal and common pleas courts and probation, for instance, have come forward with up to $500,000 in non-personnel expenditure reductions and the potential for up to close to $4 million in restricted funds that can be reappropriated. Domestic Relations has furloughed roughly 3/4 of their staff. The sheriff has been previously reported has reduced the population in the Justice Center by close to 40%. That's a huge number. We were close to 1,300 inmates in the Justice Center just several weeks ago, and we're now close to just south of 800 inmates in the Justice Center. So that's a unique issue, though, because we have now cut the inmate population in the Justice Center. The sheriff has said directly that they would eliminate and stop operating one of the towers. For those of you that don't know, the Hamilton County Justice Center has two towers, a north tower and a south tower. The sheriff has said that they would eliminate the operation of one of those towers. They can't do it because of the need to properly space inmates associated with COVID-19. So what we are looking to do is to reallocate some of our federal grant funds as a direct COVID-19 response due to the quarantining and the isolation that needs to be done in that second tower. So in total, that could be anywhere between $3 and $9 million of additional general fund support this year. The Clerk of Courts has reduced salaries, furloughed staff, and is using restricted funds where allowable to offset personnel costs, saving over $1 million. The Coroner is furloughing staff and using grant funds to offset personnel expenditures, saving close to $500,000. The Public Defender is implementing salary reductions, furloughs, and reducing assigned counsel contracts to save just south of $2 million. At Juvenile Court, we talked about the Adult Justice Center. Juvenile Court is doing a similar thing in the Juvenile Justice Center. They've reduced the population in the Juvenile Justice Center from around 110 to just over 50. At the same time, though, they've also had to set up a quarantine area and a medical unit at the Juvenile Justice Center, which are functions that we are hoping we can allocate against federal grants. We've also done things like eliminate a lot of our economic development programming this year. We had a $1.5 million economic development program that we were going to implement to assist first-ring suburban communities in 2020. That was going to be $1.5 million. That program is suspended. We've eliminated the $1 million that we were going to allocate to site readiness projects this year. We've eliminated the $400,000 that we were going to allocate to the Transportation Improvement District this year. And we've also cut by 20% the contracts with our various economic development partners. So a lot of work going on across a lot of different areas. There's a lot of different departments I did not mention, but you asked for a couple of examples. I may have gone a little bit further, but I know that there's a lot of information out there that people were looking for. So.
All right. Thank you to Jeff. Thank you to Greg. We're going to get to questions in 1 second. But at a previous briefing, I was asked about PPE, specifically about masks. And so emergency management, in collaboration with the Health Collaborative, is collecting and then distributing out this PPE. And so some of this is the national stockpile, and some of it is what we as a county have purchased through some federal dollars and assistance. Some of it's been through donations. And so I was asked about, can individuals from the community go get a mask? The answer to that is no, because those masks are in very high demand, as you might imagine, by way of the hospitals, first responders. Think about firefighters, police officers in the community, people that work in nursing homes, people that are doing home visits to make kids safe in the community. That's who's receiving the masks right now, and it's hospitals, N95s, the healthcare workers or the nursing home workers, a lower tier mask relative to the work that they do and the distance that they can keep. Regardless of that, there are ways to make your own mask. So nobody in the community should feel like they should go out without a mask on. So I was asked to do a quick video about how to make a mask. So I did that, and I think we're going to show that video before we get to questions. I'm Denise Dreihaus, President of the Hamilton County Commission. Last week, we got asked about masks, and so we are stockpiling masks, but primarily for medical professionals, for first responders, for folks that work in nursing homes. That said, everybody needs to have a mask, and so my friend Cindy sewed this mask for me. So I wear it when I go out in public, but not everybody has a friend that sews. And so the question is, how do you have a mask and how can you make one at home? And so I'm going to demonstrate. So if you have a scarf or a thin towel or a handkerchief at home, you can use that to make your own mask. So here's how you do it. So you put a hair tie or a rubber band on either end of the scarf. You very quickly pop, fold it in, and then the hair ties will go around your ears like so. That's my homemade mask. It's as easy as that. So just a reminder to everybody in Hamilton County, hashtag mask up Hamilton County. I just want to say, if I can do it, you can do it. I'm not the most adept at making things. So anyway, thank you for that. And as identified, I've got my friend Cindy did this. She's pretty good at sewing. So anyways, we're going to go to questions, Bridget. Questions for myself, Jeff, or Greg.
Sure. James Pilcher with Local 12 has a question for you, Commissioner, and also for Commissioner Greg Kesterman.
Great. Good morning.
Earlier, Greg was looks like, and you also talked about the need for governments to ramp up, government agencies to ramp up. Can you talk a little bit more about that? But we're looking at next week for some of this stuff to open up. What's the county's role in that, and what do you envision this to look like? And what guidance are you getting from the state? And what if, I know I'm throwing a lot of questions out there, but what if
Bridget is going to summarize that because we didn't hear all of it.
So he's asking for the gradual opening, and then also what does that look like locally? And then James, can you restate your last question?
Sure. So if you think something shouldn't be open yet, but the state says it should or could open, what happens then?
Okay, so that's a Greg Kesterman question. I will say, though, I think the one about how do we make sure that the public side is supporting the private side as entities start to open up. And so let me give you one example of that. So we are trying very hard to be responsive to what we know still is happening. I mean, some of these businesses are essential businesses and have been operating through the stay-at-home order. So that while the county building is closed, we are providing services online by way of the auditor, the recorder, the treasurer. We have one window downstairs in this building that is available. So if you have plans that need to be examined and approved by the county because you're building something, whether it's commercial or residential, you can make an appointment and we'll hand it through the window in the first floor. That's limited access, obviously, and we don't have enough personnel to respond quickly to those. So I guess the concern is, or my concern is, that if we start to have ramping up of some of the private side, that the public side is capable of responding to what we think we know we're going to have, which is an increased need to make sure that things start on a steady pace forward. And that's what we were hoping to use some of the federal dollars for. More to come on that. I mean, we're hearing that the money is likely to come. It just didn't come in this round. So I hope that answers the first part of your question. I'm going to turn it over to Commissioner Kesterman.
Well, actually, Commissioner, just real quick, I just want to get just really quickly your thoughts on what this is going to look like when things start opening up next week.
I'm going to leave that to Greg Kesterman, actually. I'm happy to give my point of view, but Greg's the guy in charge of trying to keep track of the order and following the public health information and advice from the state level.
Thank you very much for the question. As you know, the current order is the Director of Health's stay-at-home order. She has amended that order once to accommodate a few different changes and to create the dispute board. Everything we're doing here in Hamilton County, we have consistently tried to match the mandate under the Director of Health's order. And when it's not clear, we've tried to work as a region to come up with the best approach possible to make sure that we're aligned so that we're not treating businesses differently in Hamilton County than the city of Cincinnati, who has their own health department, might treat a business, as well as the surrounding counties such as Butler, Claremont, and Warren. Our goal is to try and be as fair and equal as possible, as well as protective of public health. As far as what's going to open, I really don't have a great understanding yet from the state. I think actually the governor and director of health are still analyzing that. I have been privileged to be on a phone call once a week at a minimum with the director of health. This week I was on a phone call with the governor and am able to learn a little bit of insight. And I think really what I'm hearing is, you know, immediately when this started in Ohio, we kind of closed things down. We did it quickly. We know we shut down the mass gatherings super quick. We know we took away schools rather quickly because those are areas where you can see a lot of disease spread and spread rapidly. We then looked to businesses, and those essential businesses were allowed to stay open but had those social distancing measures in place. I would expect as we open things back up in Ohio and as they decide the first phase of businesses to be allowed to open, they're going to have those expectations that we social distance, as well as employees might have expectations on when to mask or what protective equipment is necessary to do business as we're getting things back open. You know, we did a great job, I talked, and Commissioner Dreihaus spoke, of flattening the curve in Ohio. And what that means is less Ohioans got sick. That also means less Ohioans have the antibodies to prevent them from getting sick in the future. So as we open things back up, we have to be super careful to keep those hotspots tamped down.
So you're looking at, you know, one of the phase one, if I read the White House guidelines right, if you match your numbers and numbers show a decrease, you can open a restaurant, but what does that look for a restaurant if you also have social distancing? Are they going to have to cut back on their capacity to make sure the tables are far enough apart and you don't sit at the bar? What are you looking at there?
You know, once again, I'm going to focus on the state guidance. I would think if phase one includes opening up restaurants and other kinds of business, they're certainly going to do social distancing. If two booths are back to back, that means two people are within that 6 foot of distance, and the ability to spread disease certainly is possible. So I think as the state looks to when restaurants are safe to open, when bars are safe to open, and other kinds of businesses are safe to open, they're going to put a lot of emphasis on that 6 foot of distance, as well as when you can't social distance, using the masks that Commissioner Dreihaus just shared how to make, and we're going to ask people to wear those when you can't social distance.
Okay.
Can I just add one thing? So I know that question was directed towards me, but I want to clarify something that you may not realize. I don't have the authority to open up or close down anything. The county commissioners, that's just not our role. The health commissioner has that capability. So while I'm flattered you think I can do something like that, I cannot. So we rely on our public health officials to not only give us the guidance we need, but also to make these important decisions. So I just want to clarify, the reason for punting was that the authority lies with the public health commissioner, not with the county commissioners.
If I could just follow up on that point, though, again, what happens if, so you're saying that the county health commissioner has the ability to say, no, you can't reopen yet because we're here on the ground, even though the state says, yeah, that business qualifies?
My understanding from Greg is that he can be more restrictive, but not less restrictive than the guidance from the state.
Okay. That's what I want to find out. Thank you.
Next question comes from Jay Hanselman with WVXU for both you, Commissioner, and Commissioner Kesterman.
Good morning, Denise. I'm not sure, you were talking about that you did not get included in the latest stimulus bill, but we had a release yesterday from Senator Brown that he and Senator Portman had wrote to the Treasury Secretary asking that the Treasury Department issue additional guidance on how state and local governments can use funding secured in the CARES Act, and that included using it as revenue replacement. Are you aware of that letter, and are you hopeful?
I am very aware of that letter, delighted about the letter, and we were hoping that the language change would be in the new bill. So it's not in the new bill. So we were asking for flexibility with the money that we know we've got coming. That would be, that's our number one priority. Because if we could only use that for different purposes, that would settle it, and we wouldn't need any additional dollars. We've already got the dollars. The problem is we can't use them for revenue replacement. And so this language about flexibility was something we were asking for, and both of those senators were very helpful in advocating for that, but we didn't get the language change. Now, can that language change happen without legislation? Can it happen internal to the Department of Treasury? Maybe so. But we still haven't seen that language change, and so we're just going to keep pushing and pushing for the flexibility, because it's not only the county, you see, it's relative to all the jurisdictions in Hamilton County. So the city of Cincinnati and the other 48 who are also struggling. We just heard about a reduction in the sheriff's patrols out in Silverton and Lincoln Heights. We're all struggling through this. If we were provided some flexibility, we would hope to be helpful to all of the above. So that's what we're asking for. I do want to say, and Jeff did mention it, we had a lot of support and a lot of phone calls happening over the weekend. I do want to do a shout out to Bill Seitz, who was very helpful in advocating for what's best for Hamilton County, to Representative Shabbat, Representative Wenstrup, the two senators. And so we were enlisting a lot of our colleagues at different levels of government to help push the message, and I'm very grateful for the work he did.
Just a quick follow. The county administrator said the gap is 40 to 60 million. He said departments have come back between 20 and 30 million, with this hope that maybe some of that care be used to plug the hole. Your posture that
is he asking that, not knowing about the federal dollars, that I think Jeff alluded to the fact that we are going to be able to scale up or scale down. And so the scale down piece is, if we could get some federal relief here, then we could start to scale down, because we know that we could plug some of that revenue replacement with the federal dollars. But the uncertainty is what has prompted us to act now and ask the departments to do something now, not full bore, right? Not laying everybody off, because we are not sure. We need that relief right now because of the uncertainty in DC.
Okay, thank you. And just a couple of quick things for Greg, if I can. Greg, we've heard a lot about the availability of testing. In your mind, is the point of enough testing to be where anybody who wants a test can just go get tested, or will it always be a test where it has to be ordered by physician or a medical provider?
I'm not exactly sure what that will look like, but I do know the more testing that's available, the better we'll be able to control the disease within Ohio. Right now, we're still limited to only those with moderate to severe symptoms are able to get the test, and that does hamstring the efforts of identifying where hotspots might pop up next. Currently, if you wanted to get a flu test, you do have to go to a provider, and so I suspect that would probably be the model we'll see with COVID-19 as we move forward, although most providers are still using that guidelines of moderate to severe cases of COVID-19 before they administer the test. So hopefully as we go forward, we'll see more access to testing. I did actually see an FDA release of some home testing just before the press conference today. So we might see even some new technologies that will allow for people to get the test. One other nuance with testing, if you don't have COVID-19 yet because you're non-symptomatic, the test won't help you. It won't tell you you're going to get it. It's only going to tell you if you have it and you're symptomatic. That's when it will help. I know there are some folks that are non-symptomatic that it might show up, but I think most of us were worried, we're well, and we want to get the test just to provide ourselves some reassurance. It won't help in that scenario. It's just going to help when we know that there are some folks that might be impacted by COVID-19.
Second, we're just experiencing a little lag in our feed. All right, seems that we're back up. And we have our next question from Andrew Setters with WLWT for you, Commissioner Kesterman.
Yeah, Commissioner. What are going to be some of your concerns?
Andrew, I'm going to restate your question because it didn't come through on our end. As we restart the economy, he is wondering what additional restrictions or triggers would have to take place for you to start opening things up on your end.
Once again, as we start to open things back up, we're really actually seeking guidance from the State Department of Health. All the closures so far are as a result of their order, and we're working under that order as my team goes out and assesses business or we receive complaints about those businesses. I do suspect it will be a slow process, and I suspect many businesses will be allowed to open on May 1, but those social distancing guidelines that I've already spoke of will be in place, the 6 foot, the masking, and things of that nature. My team will get complaints about businesses as they open up, and I will be sending folks out if we see issues, and we'll do the best we can to work within the state guidelines to ensure that places are opening safe when they're allowed to.
Are you prepared for more complaints? I would imagine as you have more businesses open, you're going to have more people concerned about those business practices. And if we backslide with the number of cases here, at what point do you trigger shutdowns locally that maybe the state's not considering?
So as far as are we prepared, I will share when the director's stay-at-home order came into place, we received upwards of nearly 200 questions, complaints per day. Our team scrambled to manage that volume and got some things in place to ensure that we were able to still reach out to those businesses and address those concerns that businesses or residents had. That has very significantly dropped, so we're down to, I want to guess, anywhere from 20 to 40 complaints per day. So we do have capacity, and we are ready to address those complaints should they come in. As I mentioned, I'm on the phone routinely with leadership at the Ohio Department of Health, including once a week with the Director of Health, and my goal would be, if I'm starting to see problems here in Hamilton County, it's not going to be unique to Hamilton County. It's going to be probably something that Columbus and Cuyahoga County and Cleveland are starting to see as well, and we'll try and get that unified approach across Ohio so that we're not handling businesses individually. With each hotspot that we do find, though, my team is going to, through our epidemiologist, identify that hotspot when we see positive cases, figure out if there is a spread, and anyone who is positive for COVID-19 under the director's order, that is a Class A reportable disease in Ohio, and those individuals will be isolated, and that process and that good contact tracing that my office does will slow the spread of the disease here in Hamilton County as well.
And then one last question, nursing home data. We had some that was passed on to the state. the state kind of backed off some of that because there were some problems in it. How do you understand the situation at this point right now with positive tests in nursing homes in Hamilton County?
So nursing homes are certainly an area of great concern. They have elderly residents, and they have residents with underlying health conditions. So we know that they are a very at-risk population. The state plans to share that data today. My team has been working closely with the Centers for Disease Control as well as the Ohio Department of Health. Today and yesterday, we're actually doing some site assessments of nursing homes that have no cases of COVID-19, and our goal is to spread some knowledge and information to help try and keep those residents safe should they get a positive case. After the CDC is gone from Hamilton County today, my team will continue to go out to those nursing homes and spread that message. But we want to do everything we can to make sure that the tools are in place to slow the spread when we do have a positive case in a nursing home.
So you said the CDC is actually in town now looking at nursing homes?
Correct. We have a team with a couple folks from the Centers for Disease Control as well as the Ohio Department of Health and my office going to a few nursing homes here in Hamilton County that have no cases to make sure they're prepared.
I had 2 follow-up questions. He wanted to get your thoughts, Commissioner, on the antibody testing that's been reported on, and does the county's health department plan to hire additional people to do contact tracing?
So I'll start with the contact tracing. We have been working to increase our ability to do contact tracing. Actually, we've worked a lot with County Administrator Jeff Aludo and the county commissioners to utilize some county staff to help us with that. Training happened last week and again this week, and we are going to start offloading some of those cases so that we can balance our work and make sure that we do have additional folks trained should we see another spike in cases. So that is our current plan, to utilize county resources. We have actually brought on also some folks from the Hamilton County Education Service Center, some school nurses that aren't currently working in schools. They're providing some of that skill set as well. So we're going to keep using resources here locally and try and make the greatest impact possible. With regards to additional antibody testing, certainly anytime you have the knowledge that you've had COVID-19, you should have antibodies in your system. I would say it's just another type of test to confirm that you've had COVID-19. It is not necessarily the perfect test. We've heard a lot of comments about error rates for that test, and I think until we have a better understanding, it won't be the perfect solution. The other advantage to antibody testing, there's been a lot of work nationally and here in Cincinnati at the University of Cincinnati where they're using blood or plasma from those individuals that have had COVID-19 to help cure some folks who are in intensive care by transfusing that blood. So that's another test and tool in our battle with that regard.
Can I elaborate on one thing? Just very quickly, I just want to elaborate on what Greg just said about capacity issues for public health. So when Jeff talked about some of the strategies at the county level, we are redeploying people to public health. You just heard Greg talk about how they need to be trained, but it's one of the budget strategies is to take an employee who is unable to do their work right now at the county and redeploy them and pay for that employee through the federal dollars, because that is a response to COVID-19, and so it qualifies from our estimation. And so it's an example of how the administrator's gotten rather creative with the idea of what the federal dollars can be used for and where the greatest need is, and obviously that's public health.
Thank you, Commissioner. The next question is for you, Greg Kesterman. It comes from Chris Wetterick with the Business Courier.
Hi, Greg. On the graph earlier that Denise showed, the dates that we see on there, are those the dates that the cases were originally reported? Is that what we should take from those dates, just to check?
I'd have to actually double check.
I'm Denise Dreihaus, President of the Hamilton County Commission.
Individuals. There's actually a group of folks from the hospital systems, and my team is part of it, where we're trying to do some better analysis here in Hamilton County and some projecting. And there's a few methods that are being utilized. We're using some of the symptomatic dates, we're using the test dates, and we're trying to figure out which is the best predictive model for seeing where cases will go from here.
Okay, thank you. And then one question, it's kind of similar to Jay's earlier, but I think it's an important one because businesses are kind of being told, look, we need to have really good testing before we reopen. And I'm curious how you, as a health official, define what an adequate testing regime is going to be, and what is the status, in your view, of where we are in terms of getting to that point?
So right now, the standard that I would hold as the high standard is that which the governor and director of health have utilized, and that is making sure sick employees stay home. But one step further, don't allow folks to come to work without taking their temperature, and making sure that they're practicing hygiene within the office, cleaning surfaces down, and making sure the office is sanitized for both the employees as well as the customer. As far as a COVID-19 test, there's a couple different standards if somebody has COVID-19 before coming back to work. The first standard would be 2 negative tests, 24 hours apiece, and that would be a tool to prevent them from coming back to work sick. The other standard is 7 days from the onset of illness, not coming to work, as well as 3 days from the conclusion of any fever or symptoms, would be another tool that's utilized for allowing folks to go back to work safely.
I guess I meant, what's the stat, or I guess, how do you define adequate testing in terms of the volume of tests? How do you define that? Like, when do you think we're going to have enough tests? And what would be the conditions under which?
No information yet as to when Ohio will see the number of testing that we would like to have to further improve our knowledge of COVID-19. As I mentioned earlier, we're still only able to test those with moderate or severe symptoms. We'd like to be able to start testing those with mild symptoms as well, so we can have a better picture of all COVID-19 cases. But I know the governor has put a lot of work and effort into this. Each week he comes online with another FDA approved test here in Ohio, or a test that he's able to work around the FDA approval to get it fast-tracked. So each of these tools will increase the ability for us to test.
Sorry, one other question related to that. Just for readers, what is a mild symptom? How do you define that?
So, a slight cough would be a mild symptom, and if you're starting to have that cough turn into a significant cough with shortness of breath, that starts to become a moderate symptom. Moderate with some underlying health conditions, including diabetes, obesity, heart disease, any of those types of things would then qualify you for the class 2, which most physicians would test on.
To a severe symptom?
Symptoms can range, obviously. If you're being treated by a physician, your blood counts drop significant, or your oxygen counts in your blood drop significantly, all the way to being on a ventilator in the hospital.
I have a couple of questions. Is there a period of time for the furloughs that you've announced today, or are they kind of indefinite?
Yeah, so you echoed a little bit there, Chris, but I think I got the gist of your question. So the period of time for the furloughs, so they're gonna range in nature, and so I would defer to each independent office in terms of their implementation schedule for them. The Ohio Revised Code provides some restrictions in terms of what counties can do from the perspective of furloughs. Don't even actually call them furloughs, they call them cost reduction plans, and they're limited to 80 hours per state fiscal year for certain classifications of employees. So a lot of it depends upon whether you are a classified civil servant, whether you're exempt, whether you're unclassified, and so the amount of time that an individual furlough is going to extend is going to depend upon the category of employee. But we have some that are ranging from just 2 weeks to some that are ranging for up to several weeks, just depending upon the classification of employee at this point.
And then one other question, can you have the budget office email us a department by department job furlough number?
Yes, we can get you the department by department as we know them today. Now I can tell you that there are some departments, and we're still working on some clarification, that may have termed part of their strategy a salary reduction when in fact it is in fact a furlough. So we can get you what we have, and we can update it as we go.
Thank you.
You're welcome.
The next question comes from Scott Wortman with the Inquirer for you, Jeff.
Hi, Jeff. You were going in and out when you were mentioning some of the examples, but I also want the positions furloughed, if possible. But one of my questions is, first off, what percentage is the 200? Is that of the 1,300 county employees or the 3,200 county employees looking at the entire county budget?
So, we got a lot of echo going on right now, Scott. I apologize. So, I don't know that I got all of your question. I'll answer the last part first, then I'll defer to Bridget, who can fill me in on the first part of your question. The number of furloughs that we are looking at right now is related solely to the county general fund population, which is roughly 2,000, just north of 2,000 employees at this point in the general fund. But there are closer to 4,000 employees across all funds. This is just county general fund at this point that we're talking about. So I can get you the total numbers in the general fund and all that immediately after this, Scott. But Bridget, there was another part of that question at the beginning that I did not get.
Yeah, Scott was basically saying that he would like the same information that Chris Wederick had requested from the budget office as he's requested it as well. Scott, do you want to try to ask another question? I could reiterate if we don't
Yes,
hear it.
yeah. Which department took the biggest hit?
Can you say which department took the biggest hit
Yeah, so I
out
think
of that 200?
from a furlough perspective, I think the majority of them at this point, or the most significant number, is in the clerk of courts. I can get you the exact number, but I think it is somewhere close to 170.
That's almost all of the 200 employees are in the clerk of courts.
We're actually closer to 240 or so furloughs, Scott. So but the clerk of courts is right now around 170, and again, we expect there's probably going to be some more coming in as well as different departments report on plans.
Any idea why that is? Is it just because of there's less volume going through the court system now, or?
I would imagine it has a lot to do with that in terms of different divisions of different offices and where different elected officials think that they have a capacity that they don't need to employ right now. And that's ultimately their call to make in terms of whether they have people who are working from home who are still actively doing work, or whether they have employees that they would otherwise be placing on paid administrative leave, whereas maybe that was appropriate for the first week or two of this crisis, as they have divisions or groups of employees that they can't employ productively right now, that they put those on furlough. So while the clerk of courts might make up the bulk of the number, of the majority of the number, we do have departments like the Domestic Relations Court, which has a smaller number of employees, but that has put essentially 75% of those employees on furlough at this point. So it's going to depend just upon the nature of the office and the nature and the volume of work going through that office right now.
Are the furloughs, have all 240 started yet, or it could happen a month from now, some of them, or how many have started?
The vast majority of them have started at this point, and we will take as we continue to move down the path on this, we will look at whether or not, at least under the board, whether those need to be extended, and I know that other offices are looking at it the same way as well.
Okay, thanks, Jeff.
Thank you.
We have a couple questions from Facebook for Commissioner Greg Kesterman that have sparked some good conversations. One is, how many people have actually been tested in Hamilton County?
That's a great question, and I do not have a handle on it. I can spend some time in research, but I'm not certain, because there's so much private testing, if I'll have an exact number. I should be able to find out the number that have coordinated testing through our office, and I'll put some time to doing so.
There's around this question. Are the doctors diagnosing all lung-related illnesses as COVID-19?
That's a great question. I think it depends on the provider. Anyone who presents with symptoms of tightness of chest and breathing and cough and a fever, certainly physicians are strongly looking at COVID-19 as a possible diagnosis, but it would be physician by physician.
Thank you, Commissioner. One more question for you, Commissioner Dreihaus, from Jay Hanselman. And this can also be for Administrator Aludo. County commissioners have taken a 10% pay cut. Have any other elected offices taken pay cuts?
Jeff Aludo, I'm looking at you. Yes, they have.
I can get back to Jay on it.
Let us get back to you with the details, but yes, other elected officials have taken pay cuts. I know AFTAB for one, AFTAB Pureval for one, I know has. So there are others too.
And it appears that we have gone through all of our reporters' questions.
Thank you, Bridget. It's been a little bit of a challenging day here, but and I know we've gone a little long, but that's what happens when you got the A-team in the room with Jeff Aludo and Greg Kesterman. So thank you both so much for the work you're doing and for being here. I'm going to leave you all with this. Less than a week before Election Day. We're in the middle of an election right now, and so Election Day is next Tuesday. Your ballots need to be in the mail and postmarked by next Monday, so you need to get this done. Now's the time. I filled mine out. I saved it for you guys, but I'm gonna put this in the mailbox today. And so please call the Board of Elections, get your application. Remember, it's 2 steps. You gotta get the application, then you get your ballot, so it takes some time. You have to have that application in by Saturday. So please call today, get your application, make sure your vote counts. Election Day is next Tuesday. Thanks, everybody. We'll be back on Friday.